Hello, good morning, and welcome to the next ARC Talks webinar in our series of webinars that provide information on different areas of amyloidosis for patients and caregivers. I'm really excited to welcome Brianna Pino today, who is from my alma mater, Boston University School of Medicine and Boston Medical School, where she works in the hematology and oncology department. As a patient there, I really experienced the challenges around nutrition and GI issues that many patients with amyloidosis experience, both from their disease and also from the treatments. So learning how you can really look after yourself nutritionally and stay as healthy as possible, I think is absolutely critical to better health and care. I am going to just give for a moment, talk a little bit about ARC and the work we do. The Amyloidosis Research Consortium was founded in 2015. Our focus is to make a significant impact on the curability of amyloidosis. We have a consortium model where we bring together all the stakeholders who work in amyloidosis to really advance the science and understanding of the disease and accelerate drug development. We have 4 areas that we focus on: improving the speed and accuracy of diagnosis. For many patients, diagnosis can be a long odyssey, and it's really important patients are diagnosed earlier. Increasing the understanding of the science behind amyloidosis so we can identify treatments. Accelerating regulatory approval and reimbursement of treatments. Clinical trials can take a really long time, and reimbursement after they're approved can be challenging. And also enhancing care and quality of life for patients through educational initiatives and support. So this program falls into that last area, and I think really informed patients do better overall. They access better care and treatment. I want to thank our sponsors today who've supported the ARC Talks program. And with that, I'm delighted to hand over to Brianna.
Thank you so much. Hello, everyone, and good afternoon. I'm going to pull up my presentation here. So thank you so much for having me. I'm so excited to be presenting today. I am presenting on amyloidosis and nutrition, and these are some general guidance on how to eat for your health. A little bit about me. I've been a dietitian for 10 years, and for the past 4 years, I've been working here at Boston Medical Center and working with this population. So today we're going to get a good understanding about just the how to eat and the components on how to eat for a well-balanced diet. Next, we're going to talk a little bit about understanding the role that nutrition specifically plays with amyloidosis management. We're going to talk about nutrition and symptom management. And then at the very end, we're going to touch on how to get the help you need. So before we start a poll question, I just thought a little bit of information will help me guide my discussion today. For those of you who have been diagnosed with amyloidosis, what is your primary site of involvement? So the heart, GI tract, kidneys, liver, autonomic nervous system, or all of the above, because multiple sites are affected. Take your time. All right. I'm not sure if that is working. I'm not seeing any results from my end. Oh, here they are. Perfect. So 51% have heart, okay, and then coming in at a second, multiple sites. So this is really good for me to hear a little bit the discussion down the line and to know what questions I might be answering later. So thank you guys all for sharing. So to start, what makes a well-balanced diet? I'm sure you guys hear a lot of things. It's a very hot topic, nutrition on the internet and in the media, but we generally follow as dietitians research-based guidelines. And in 2020, the most recent USDA guidelines came out to direct the general population on how to eat for health and wellness and to help prevent chronic disease. Their motto for this was every bite helps. So it really was trying to emphasize that every single bite that you put into your body can really make a difference long term. The guidelines, one of the major guidelines was that they wanted to decrease the intake of added sugars in the American diet. And one of the recommendations was by limiting sugar sweetened beverages. The ideal goal is to have less than 10% of your calories from added sugar, which is still a lot of sugar. And they really encouraged people to drink more water. The next is that they wanted to lower the sodium intake of Americans. Sodium is found in a lot of processed foods to preserve the food. So generally what I tell people is that you want to start by always shopping on the perimeter of the supermarket, because that's where a lot of the fresh produce and fresh foods are, which have less sodium in it. The goal in the recommendation is to eat less than 2,300 milligrams of sodium every day. The next recommendation was that they wanted to continue to encourage everyone to eat more fruits and vegetables. So my favorite way to explain this is that every time you eat, half of your plate should be fruits and vegetables, as seen on the image here on the slide, and that you should always try to eat the rainbow. So it doesn't have to be every day, but by the time the week is over or the month is over, you should kind of keep in the back of your mind that you want to get in a red, orange, green, blue, yellow fruit and vegetable into your diet. The color of fruits and vegetables corresponds with different vitamin and minerals or phytonutrients that might be present in the food. So for example, dark leafy greens have a lot of vitamin K, red fruits and vegetables have a lot of lycopene. So you can use that as a way to get those phytonutrients and flavonoids you need to help keep those healthy cells healthy and help limit the damage from stress that's going on in your body. It can also help to decrease inflammation. The next recommendation is to limit red and processed meats. Ideally eating as little to no processed meats, and that would include things like prosciutto, deli meats, sausages, things like that, and to choose more lean meat, fish, and plant-based protein. Plant-based proteins are things like beans, lentils, and whole soy products. The next is to choose whole grains. We want to make 50% of the grains we take in every day whole grains if we can, if not more. And part of the reason for this is that whole grains are a huge source of fiber. Fiber is so important for our body, and fiber can help reduce the likelihood of chronic disease long term, such as reducing the likelihood of things like colon cancer. It can help with GI health. It can help reduce your cholesterol. So the recommendation is men get 38 grams of fiber every day, and the recommendation for women is 25 grams. Fiber is also found in a lot of fruits and vegetables. So by filling your plate with fruits and vegetables, you'll help to meet that goal. The next recommendation is to just limit alcohol. So ideally as little as possible. But if you are consuming alcohol on a periodic basis, no more than 2 servings per man for the men and no more than 1 serving for women. And finally, choose low-fat, fat-free, or fortified soy. And this recommendation is here because these products can be really good sources of protein and also great sources of calcium and vitamin D, which can be good for bone health. Doesn't mean you have to have milk at every meal as seen as this picture. It's just a reminder to incorporate foods like that into your diet. And when talking about a well-balanced diet, in health and wellness, we can't not talk about the benefits of exercise and wellness. Exercise is good not only for strength, but also for your mental state, your physical state. The U.S. Department of Health and Human Services recommends 150 to 300 minutes of moderate exercise a week to 75 to 150 minutes of high intensity exercise. And this basically levels out to making sure you exercise 5 to 7 days a week. And 2 of those days, we recommend adding in strength training. So this can be weights, this could be your own body strength, this could be bands, but incorporating this into your weekly exercise regimen if you're able to. So why we're here, why is nutrition so important when dealing with amyloidosis? It is estimated that about 65% of patients with amyloidosis are malnourished. And malnutrition can result in oftentimes vitamin and mineral deficiencies, weakness, decreased quality of life. It can also increase your likelihood of treatment interruptions. So by initiating or working with a dietitian early on, it can help prevent or malnutrition from worsening or help it from even maybe developing. It can also help improve your quality of life because a dietitian can help with symptom management. It can also help to just generally maintain your body weight and strength. Additionally, it can help from decreasing hospital length of stays. And so we know how important it is to be at home and be doing what we love. So staying out of the hospital is extremely important. So everyone's always looking for the magic bullet. And unfortunately, there isn't one specific pill or vitamin you can take to help cure or even significantly improve the condition. Typically, vitamin and mineral supplementations are not recommended, and especially not recommended without speaking to your care team first, as these can interact with your treatments. It can limit effectiveness at times. Additionally, vitamin and mineral supplements are not regulated by the FDA. So they may say there's something in it, they may say it's a certain dose, but there's not 100% guarantee that that is what's in the product. Generally, what I do is I monitor patients from a case-to-case basis. And if someone is at a high risk for a certain deficiency, I will try to recommend lab draws and repeat on a case-by-case basis. So getting more into symptom management and the nitty-gritty of nutrition in this disease state. I will start by saying this is by no means a comprehensive list. There are a lot of symptoms that may not be mentioned here that you're experiencing that you can ask me about after, but these are the symptoms that I'm most regularly working with. And again, these are not all the organ states that are affected. I recognize that. So the GI tract is one major organ system that is affected by this disease state. And it is affected because the proteins build up in the GI tract, and it can affect the ability for digestion or proper digestion. It leads to a lot of different symptoms, some from the disease itself and some from the treatment. For example, xerostomia, which is dry mouth, can be from medications. It could be from inadequate hydration. I talk a lot about talking about how to improve this. One, starting with improving your hydration overall. And then incorporating high water content foods into your diet, things like fruit or even frozen fruit that you suck on throughout meal times to help keep that dry mouth at bay. Using different sauces or softer foods or different sauces to moisten your food can help with that as well and make food more palatable and tolerable. Using a at-home mouth rinse is my favorite, using a little bit of salt and baking soda with water. Rinsing your mouth with this before meals can help with dry mouth, general mouth hygiene, and also help prevent or limit taste changes. So using that, sometimes a little bit of carbonated water can break things up. Additionally, also using different saliva, artificial salivas can help as well. Avoiding smoking, using a humidifier, and avoiding alcohol-containing mouthwashes are all recommendations I would also make for this condition. Gas and bloating are two other symptoms that I deal with regularly. Again, could be due to maldigestion, it could be due to medication, it can be due to, as a result of some other side effects on here, like constipation. Generally, we start by reducing your intake of gas-forming foods, and then also looking at eating more small, regular meals, more bland, more foods more easily to digest. Talking about different cooking methods to help break down foods, avoiding raw foods and trying more cooked foods. And then also limiting your intake of air. So if you're someone who's using a straw all the time, you're chewing on gum all the time, I might ask you to pull back on this to see if that helps. Early satiety has a lot of similar recommendations. We start with small, regular meals. We try to talk about nutrient-dense options so that every bite you take, you're getting more bang for your buck. So we're looking at those high-protein foods, those high-calorie foods that still offer vitamins and minerals and good nutrition to try to get you to that calorie goal with fewer bites because you're just feeling more full more quickly. Constipation, bowel regimens, talking about foods that can help ease constipation, assuring adequate hydration, making sure if you're safely able to, getting in a little bit of walking every day to help with that. Talking about some natural remedies you can use, if making sure they don't interact with treatment, of course, but oftentimes things like prune juice, aloe vera juice, even just some warm water with lemon on an empty stomach first thing in the morning can get things going. Dysphagia is another symptom commonly experienced. This I often recommend a speech and language pathology referral, but also I'm able to help a little bit with this in regards to talking about timing of meals and making sure when you're eating, you're as alert as possible, avoiding periods of high fatigue, and also a little bit of alterations in your texture of your foods to meet your needs. Bleeding, macroglossia, we want to avoid spicy foods, caffeine, alcohol. And then we're going in the next slide to get a little bit more into gastroparesis, which is a symptom I'm dealing with quite regularly. So management of gastroparesis, typically, again, some of the similar recommendations you're seeing show up here, but small, frequent meals and snacks. We want to make sure you're eating every 2 or 3 hours and in much smaller portions to help with digestion and keep things going. Oftentimes, we recommend avoiding high fat and high fiber foods because these foods take longer to digest, so they sit in your stomach longer and are what instigate a lot of the feelings of nausea, early satiety, fullness, and bloating. We recommend trying more bland, lower fiber foods that are simple and easy to digest. And oftentimes people do pretty well with liquids and very soft foods that are cooked well. We want to use gravity to our benefit. So instead of laying down after meals, you want to make sure you stay upright, at least sitting upright at a 45 to 90 degree angle to help gravity do its work and get things moving through your GI tract. Ideally, even maybe standing for a little bit if you're able to tolerate it. Making sure you chew foods well. So taking your time, chew things till they get to a pureed, almost ground pureed texture. You want to chew excessively to help with the digestion of the foods and help it get through your system more quickly. Assuring that you have adequate blood sugar control if you are someone who has diabetes, and making sure that we try to control that as best we can because uncontrolled blood sugars can also worsen gastroparesis. Additionally, working with the care team to talk about if prokinetic agents, so medications to help move, help your GI tract move, which will help with digestion. So seeing if these are appropriate and work within your care plan. Some other organ states, sorry about that, that are also involved are the heart and the kidney. And as we did the poll earlier, we learned that a lot of you are experiencing issues related to your heart function. Oftentimes, the symptoms I'm working with patients to help manage are these: hypertension, shortness of breath, fatigue, nausea, anorexia or poor appetite, edema or fluid overload, malabsorption again, and ascites, or fluid that builds up in your abdominal cavity. It is extremely important to pay attention to the nutrition recommendations in regards to these, because oftentimes you do see you can see a quick turnaround from some alterations in your diet, specifically with sodium, which we're going to address in a couple of minutes. So management of congestive heart failure, and this is when your heart is not pumping effectively. First and foremost, we recommend a low sodium diet. And this would be ideally less than 2,000 milligrams daily. Then we want to talk about also, though, optimizing every bite. Oftentimes when you're experiencing congestive heart failure, you're extreme short of breath, and you also may have a lot of fatigue. So talking about ways to easily prepare meals and snacks, choosing nutrient-dense options again, and thinking about ways to make sure you have the support you need at home so that you can get adequate nutrition while dealing with some of these side effects. And also this may require a fluid restriction. So working with the care team to identify what that restriction might be and how you can not go above that. A lot of patients also on experiencing congestive heart failure on diuretics. One of the most common ones, in case you don't know what that is Lasix. So that's helps to flush the fluid out of your system. Also may have electrolyte abnormalities. So I would be working with patients to monitor those as labs are drawn and help with repletion if needed, or talking about adjusting your diet if needed as well. Fluid overload is another symptom that's connected to congestive heart failure, because these patients with congestive heart failure also oftentimes experience fluid overload. But there may be some other situations where you're not, and you may be experiencing this. Fluid overload would include things like ascites. So again, that is the buildup of fluid in the abdominal cavity, and edema, which is fluid buildup in other parts of your body. Most commonly, we're seeing it in the feet, the ankles, the legs, the arms, and oftentimes, sometimes you can even see it in the face. So this would also require a low sodium diet to help prevent additional fluid from building up in your body. Sodium and water are like magnets to each other, and opposites attract, and that's exactly what happens. We recommend a high protein diet oftentimes with this, because protein can help with rebalancing the fluid within the body. Specifically, I'm oftentimes pushing protein for people who have ascites and are requiring removal of that fluid regularly. When fluid is removed, it takes protein with it, so it requires the repletion of that. And then again, a fluid restriction to help prevent more fluid overload than you're already experiencing. Management of nephrotic syndrome. So this has to related to your kidneys. Kidney dysfunction is very common, and we often monitor not only your electrolytes, but in your renal panel to kind of see what kind of recommendations might be needed. People who are experiencing nephrotic syndrome may require specific vitamin and mineral supplementations that are specific to renal. So you have to be very cautious about what you're providing. So it might be a specific renal multivitamin, or even a phos binder if that's something that you're having elevated phosphorus levels. One recommendation is, again, we follow that low sodium diet. It's so important for heart and kidney health. We may recommend a fluid restriction. You're going to be cautious of the fluid that you're taking in, but different from the other two conditions we just reviewed, we're going to be cautious with protein intake. We're really not going to want to push too much protein, because being cautious with protein can help delay the start of dialysis if that might be the avenue that's you may be experiencing or you may be looking towards in the future. So we want to try to delay that for you. In addition, these patients experience proteinuria. So this is protein in your urine. When that happens, the liver then kicks into gear and tries to create added protein, then increasing the cholesterol in your body. So we're going to monitor your cholesterol through this time and make alterations with your diet accordingly. Oftentimes low sodium, avoiding saturated fats, and trying to increase your intake of healthier and anti-inflammatory fats like omega-3s. Another condition that people experience are orthostatic hypotension. So this is when you stand or you move your body quickly, you might notice changes in your blood pressure. So assuring that patients are meeting their hydration needs because of this, so that they have, that this meeting your hydration needs can help limit the shift or the extent to that shift. So one thing I am doing very regularly here at Boston Medical Center is working with patients who are undergoing stem cell transplants. So I couldn't end the presentation today without talking about nutrition and stem cell transplantation. There's a lot of research that has been undergoing over the years in regards to nutrition and stem cell transplants. In the past, there's been this push to follow what we call a neutropenic diet. And here at BMC, we haven't been pushing that recently at all, but in 2022, another meta-analysis came out with over 1,000 patients looking at the difference between patients who followed a neutropenic diet and those who followed a standard diet. And there was no difference in rate of infection or mortality between these two populations. So this has kind of hit the nail on the head that we don't need to follow this restrictive neutropenic diet anymore, or at least for the time being until more research is done. And I've been working with patients to just follow a well-balanced diet during the transplantation process. What I talk to patients more about is just being aware of food safety. So making sure that you're cooking foods to the right internal temperature, you're avoiding raw or undercooked foods, not eating raw eggs, making sure eggs are cooked thoroughly, no raw cookie dough or Caesar salad dressing because those oftentimes contain raw egg. We talk about how to prepare your meals and the importance of hand washing and making sure that food is stored right. And this just helps people so that they can continue having the variety that they might desire during this time and being less restrictive to help their overall nutrition. There are very few foods that we actually recommend completely avoiding during this process. And then finally, just, in regards to food safety, making sure things are pasteurized, making sure you switch utensils and sanitizing between going through raw and undercooked or raw meats to fresh fruits and vegetables. And that's kind of it. If you have more questions about this, I can dive deeper into this in the Q&A. And then finally, just working with patients through their stem cell transplant to deal with symptoms as needed. So everyone reacts to treatment differently. So working with patients, if they're experiencing constipation, nausea, vomiting, diarrhea, poor appetite, weight loss, weight gain, taste changes, I would be available to assist with those. So what can a dietitian do to help? You've learned a few things today, hopefully, but generally what we do is we help with symptom management. We provide medical nutrition therapy. So providing specific recommendations to help treat or lessen your medical conditions. We can provide education on specifics on how to meet your nutrition needs. We can assess for malnutrition. So I am trained to do nutrition-focused physical exams to go through from head to toe and look at your hair, skin, nails, mouth, eyes, any symptoms you're having, to see if you may be showing signs of malnutrition or any specific vitamin and mineral deficiencies. I can assist with making specific recommendations into nutrition products, such as oral supplements that might be appropriate to use during treatment. And I can also assess to see if you're getting or you qualify for coverage from your insurance company. Finally, I can help educate on food and drug interactions to make sure that the medications or the foods you're eating don't interact with the medications you're receiving. For example, one of the medications I sometimes talk to people about is Velcade, which can have some food and drug interactions with vitamin C and grapefruit juice, and I believe green tea. So working with patients to make sure that they're aware of any of these interactions with the medications they're taking. And so the best way to get the help you need is to advocate for yourself. And if you haven't already met with a dietitian, I always encourage people to request a referral, whether it's in the facility you're getting treatment or for an outpatient setting, because it's so much easier to help prevent some of these issues from occurring than trying to work our way back and try to solve issues and help solve symptoms once they're so advanced. So advocate for yourself and request a referral with a dietitian. These are the references I used for this presentation today. And I'm going to now open the remaining time we have to any questions that you guys might have about the slides I presented, the information I presented, or any other nutrition related questions. And I thank you guys all for your attention.
Thank you so much, Brianna. That was a fabulous presentation, and we have excellent questions. So I will dig right in and ask you. Does a high protein, low carb diet have an adverse effect on kidneys or have any effect on light chains?
Okay, yeah, so that's a great question. So first, this is a case-by-case situation. To give a full in-depth answer to this question, I would have to see your lab values and see your specific treatment plans and things like that in your past medical history. But to generally answer this question, if you're someone who's experiencing nephrotic syndrome or trying to delay start of dialysis, sometimes it specifically having protein in your urine, it can be effective to not eliminate protein, but reduce protein in your diet. The recommendation for people who have protein in their urine, significant protein in your urine, is to follow a diet of about 0.6 to 0.8 grams or a little bit less, depending on what's happening with your body, protein per gram per kilogram of your body weight. This would be a dry body weight. So it can be helpful for certain things in regards to your kidney function. If you are already on dialysis, that recommendation is not true, and you actually need to do the opposite and follow a high protein diet. In regards to low carb and kidney health, I don't necessarily think you need to follow a low carb diet for kidney health. Be depending on what else is happening in your body. Do you have diabetes? Then maybe yes, or a moderate carb diet, or trying to find those high fiber carbohydrates to help with blood sugar control. But yes, not necessarily. Definitely, high protein could have an adverse effect. To just go back to this, high protein could have an adverse effect if you have protein in your urine with nephrotic syndrome. A low carb diet may not have an adverse effect. It would really just depend on what's happening. You want to make sure you have added calories, so you could only pull so many things out of your diet and restrict so much. So that's why a dietitian referral could be helpful to really go through the nitty-gritty of that. So yeah, high protein, if you have nephrotic syndrome and protein in your urine, can have an adverse effect, but not if you're on dialysis.
Thank you. This is an interesting one. Most fruits and veggies in the store are picked far before ripening when antioxidant levels are not optimal. Only those growing their own fruit and veggies should be getting optimal antioxidant levels. Do you suggest use of a supplementary antioxidant?
No, I oftentimes do not recommend any additional antioxidant supplements at all. Unless you have something specific. Of course, I would do research if you have something specific in mind to look at the data behind that, but it can interact with your treatment and your ability, the treatment effectiveness. What I will say is you make a great point. So yes, fresh fruits and vegetables are picked and then shipped, and then, as every day that they're off the vine, yes, there is some degrading of the nutrition in those. However, some fruits and vegetables are better than none. There are still some there, but I would say that frozen fruits and vegetables are frozen fresh off the vine or the tree or wherever they're picked. So those actually have pretty high levels of vitamins and minerals compared to canned or fresh. So you could actually just maybe incorporate more frozen into your diet if you're unable to grow them at home.
That's interesting. Can you discuss cheeses?
I can. I'm not sure exactly what you're referring to in regards to this. I mean, in regards to dairy or cheeses, I'm not sure if you're talking about the stem cell transplant. I'm not sure if you're referring to the protein content, the vitamin mineral content, or just its general effect on your health. So I'm going to try to give a touch upon a little of this, I guess, at all. In regards to dairy is an important part of a well-balanced diet. Depending on your specific medical conditions, we may alter low fat to moderate fat dairy, depending. Cheeses have calcium and vitamin D. So that is important for bone health. It also is a source of protein. So someone who may not be into meats, it could be a good source of protein for you. In regards to heart health, we do need to be careful of having too much cheese, as it has saturated fats in it, unless you're choosing a lower fat one. In regards to a stem cell transplant, cheese is okay as long as it's pasteurized, but we do recommend avoiding soft or molded cheeses during the initial stem cell transplant. Typically, I say to about day 100 or 3 months after, when we're starting to see recovery. If you have a specific question, drop that back in if you want to be a little bit more specific, and I could try to answer that a little bit better.
So another food question is coffee, caffeine. What's the, do you have any recommendations about caffeine?
Okay. So generally, caffeine, I recommend everything in moderation. Okay. So if we're talking about well-balanced diet, everything in moderation, a little caffeine is generally okay. Now, if we're talking about other aspects of caffeine in regards to symptom management, so you're having upset stomach acid reflux, avoiding caffeine. If you're having bleeding, avoid caffeine. If you're having heart issues, so heart palpitations, cardiac issues, you may want to avoid or limit your caffeine. But generally, if I'm assuming this is coming from someone who has the diagnosis of amyloidosis, if you have those certain conditions, you might want to avoid it. If those aren't something that's a major factor in what you're going through right now, a small cup of coffee once a day or a tea once a day may not be as big of a problem.
And there are 2 questions around gastroparesis. One was, could you actually define what that is?
Yep.
And also, does it cause constipation?
Aha, yes. Okay, so let's talk about this. So gastroparesis is slowing of the gut, the gastrointestinal tract. So what happens when someone has gastroparesis is that you think, your intestines are, if you remember that slide, your intestines are like so long, they're very long. And so your stomach has difficulty contracting to move the food to that very long intestinal tract. So basically it's the slowing of the gut or the gastrointestinal tract. Oftentimes constipation is a side effect or could be a side effect of gastroparesis. as things are moving more slowly through your gut. So one of the interventions I work with patients with is trying to choose foods that are more easy to digest and can more quickly travel through the gut to then limit those symptoms of constipation, early satiety, fullness, and bloating.
And then there's another one that's maybe slightly related. Aren't gas-forming foods we should avoid the very ones otherwise recommended for increasing fiber and antioxidants?
Yeah. So I mean, and I want to be very clear that, we talked about what a well-balanced diet is, and then we go into what symptoms patients who have been diagnosed with amyloidosis are experiencing. And you're going to find probably with a lot of frustration that you can't follow that. And so it's part of my job to help us find that middle ground between that well-balanced diet and also comfort, symptom management, and trying to get you halfway there, as close, merging these things together to get you as healthy as you can be. So yes, I think you're saying, the gas-forming foods like cruciferous vegetables, beans, lentils are some of the most common things. Yes, those are the ones that are high nutrition foods that oftentimes with gastroparesis you may not be able to eat, or if you're having a lot of gas and bloating, you may not be able to tolerate. So some things I do though is work with patients to talk about preparation ways to help reduce the gas and bloating. So sometimes patients are able to tolerate cooked vegetables. Sometimes though, which is like my favorite thing, is that we can actually make these fruits and vegetables into smoothies. And oftentimes, even if you have gastroparesis, you can tolerate liquids. So making them into smoothies so that you can get some of those vitamins and minerals from the fresh fruits or frozen fruits and vegetables. I hope I answered that.
Yeah.
I feel like I could go on and on for that one.
There are quite a number of questions around supplements and also sort of the supplements and how they might interact with or prevent amyloidosis. So I think a big one that many patients have heard mentioned is green tea extract. They've also mentioned turmeric, curcumin. So yes, any comments on whether those are recommended, what you should consider if you want to take those?
Okay. So in regards to green tea and our, or supplements and nutrition products, a lot of times what happens is these extracts, pills are in an extremely concentrated and extremely potent dose. So the level you're getting from a pill or an extract is just so high compared to naturally eating these antioxidants naturally from food and beverage that it can cause some of these interactions. Without seeing the exact medication regimen you're on, there may be times where it's okay to incorporate it if you're feeling super adamant about giving it a try, but knowing that you go through the research that exists between these supplements and potential interactions or side effects from these supplements. In the past, I've had patients take something only to find out later that have caused severe side effects that have resulted them going into the hospital because they couldn't produce red blood cells or something, because some of these things can be really strong and we just don't know what is in them because it's not regulated by the FDA. So I always start by trying to meet your needs with food alone. And again, taking it a case by case situation. I can't, there's no specific vitamin or mineral I can recommend or supplement I can recommend today for generalized. I don't recommend one. In regards to green tea, drinking a cup of green tea is different from maybe a green tea extract. I would again have to look at the medications you're on. I know this is such a challenging topic because it's hard to eat sometimes and you just want to push anything else you can get easily into your body to help. But there are a lot of negative side effects that can happen. So again, if you're someone who is really interested in things, this is where I think you need to get your care team on board with making a referral, because there are resources, like if I were to work with you, that I could go to pull up the research from us and take the things you're interested in case by case and look at the pros and cons, the potential interactions, talk to the care team, and then we can go from there. Because we do want you involved and we want you feeling comfortable with your treatment.
And there is a question which I think quite a number of patients have experienced, which is saying you discussed diet for constipation and diet for diarrhea, but what about those of us who alternate between the two daily?
Yes. That is a challenging topic that often takes appointments upon appointments upon appointments to try to work out. There are some things we recommend when you're alternating between the two. And I'll take you through a couple of things I would look at. First, I would do some diet recall and looking if we can find some trigger foods. Looking at why or what medications you're on and how to maybe change it up in regards to bowel regimen to help with this, or looking at what foods you're eating regularly and how to switch those. Sometimes to help control constipation and diarrhea, we can use more soluble fiber. So there's two types of fiber, one being insoluble fiber. That's the fiber, this is not like the funnest topic, but the fiber that is not really well digested. So that's what bulks your stool, versus soluble fiber, which can help with softening your stool, but also it's almost like a glue. So it doesn't really bulk it, but it keeps things together to help slow things a little bit through the digestive tract to help increase absorption. We may want to try maybe increasing the soluble fiber, pulling back on the insoluble fiber to help with management of that. And that can be done through medication like Benifiber, but also can be done through certain types of food that are high in soluble fibers, such as applesauce, pectin, bananas, oatmeals, canned peaches and pears, potato rice, cooked carrots are all some examples of some soluble fiber. And then avoiding trigger foods, so looking at caffeine, things like that to help limit fast or that things that could cause like quick turnover in your gut. Looking at maybe a less high fiber diet. I mean, like less insoluble fiber diet. I can't even say this. Less insoluble fiber in your diet, more soluble fiber, and then also looking at the fat content of your diet. But yeah, that is one of the hardest things to manage.
So thank you for that. And we have two questions here. I'll go with this one. What, if any, are the benefits of walnuts or almonds or similar nuts?
Okay. I'm going to try to take this in regards to just general. Nuts in general are a protein source. So if you're someone who is more plant-based in your diet, it can be a good source of protein, some B vitamins, and it can be a source of fiber. Nuts are a source of healthy fat. So oftentimes you can find omega-3 in things like walnuts. So those are some benefits, general benefits for nuts. I always like to, and I don't think I specified this in regards to like a general well-balanced diet. And the research is showing, and I'm trying to move more into talking about this with patients, is trying to increase the plant-based proteins in your diet to try to follow a plant-based meal or day once or twice a week for just general health and wellness. So nuts can be incorporated into your diet that way by, adding on top of soups or salads or into your breakfast, chopped up into oatmeal and things like that. I mean, there's plenty of different ways. But those are the general benefits of some nuts. I mean, I could go on and on forever. In regards to amyloidosis, I mean, it would be a protein source if you're able to tolerate them, unsalted ideally if you're experiencing some heart and kidney issues. With GI issues, we're going to want to look at maybe avoiding whole nuts and maybe switching to smooth nut butters. Hopefully that's a general answer, hit a couple of different points.
And do you recommend the use of probiotics?
Aha. So again, this is a case-by-case situation. I do not recommend the use of probiotics when you're undergoing a stem cell transplant. Naturally getting probiotics from foods can be a little bit different, but no probiotic pills during that time. In regards to probiotics, again, it would be a case-by-case situation on what is happening. I'm assuming this person may be experiencing or knows someone who's experiencing some GI side effects. There are some situations where probiotics can be helpful, but again, we're gonna want to look at what is happening with your labs. We're gonna look at what medications you're on, and then go from there. You could naturally incorporate some probiotic foods into your diet. And then also in regards to probiotics, long-term, there is some research coming out that we might want to be cautious about taking the same probiotic for prolonged periods of time, because it can actually, it's supposed to increase your gut flora, but by taking one probiotic with only like a couple strands for a long period of time may actually eventually decrease your probiotic flora. So there's some research undergoing with that that's going to be really interesting to follow up on. So again, unfortunately, this is like a case-by-case basis. In a normal, healthy person without chronic diseases or undergoing treatment for a specific illness, it's worth a shot if you're having some gas and bloating or GI issues. But generally, in regards to dealing with a complicated diagnosis, we definitely want to take a individualized look. And
yeah, and I see that there are a number of questions where patients have multiple organ involvement, and that seems to really be something that's a tailored approach to work through with the
it has to be. It has to be. And I unfortunately we could probably do multiple presentations talking about the GI system alone, the heart, the cardiac system alone, kidneys alone. I mean, we could go into all of these individual and probably talk for an hour or two about these specific symptoms and management of them. So this is, of course, like just a very generalized overview today. But you definitely need to work with someone one-on-one to help manage that, because otherwise you might be eating nothing if you don't get help. You need to learn how to triage what's most important to follow.
Mm-hmm. And there are a number of questions which have been about FODMAP diets, and are those recommended for chemo patients or people on doxycycline? What's your
I'm thinking maybe they mean low FODMAP diet. It can, in regards to like, I generally recommend that if you're experiencing bloating and a lot of gas. Otherwise, I don't generally put that restriction on someone immediately. So if you're experiencing a lot of bloating or gas, it can be a recommendation to help kind of eliminate some foods to then slowly add them back in to see what might be bothering you, or maybe they're all bothering you. But it can be a tool to help control gas and bloating. So sometimes occasionally it will come up. It's not something I go in depth with a lot of people super regularly, but I mean, some of the foods I recommend to help prevent bloating are on that list. So
this question's been asked in a couple of ways. Is there anything diet-wise you can do to prevent your amyloidosis either recurring or keep you healthy for longer?
So I mean, in regards to from occurring, not that I'm aware of. There's no specific diet that can be followed up from happening. In regards to trying to keep you healthy for longer, the diet that's going to keep you healthy for longer is the diet or the nutrition that helps with a few things. One, to keep your weight stable and your muscle tone adequate, or help you to prevent you from losing muscle tone, help keep your strength up. So whatever nutrition, this is how I start. Whatever nutrition I need to recommend to get you to be able to eat adequate calories and appropriate protein for your condition, to keep your strength up and to keep your symptoms as low as possible, in my experience, is the diet that's going to make you survive longer. In an ideal world, where we maybe didn't have some of these side effects, you would eat a diet from like the first slide that we, or like I think it was slide 4, but a diet that's extremely high in fruits and vegetables and whole grains and plant-based proteins, limiting your intake of alcohol and red meats and processed meats, focusing on eating whole foods and limiting your intake of processed foods to keep the sodium low. That would be the diet long-term, in an ideal world, that would keep you healthier the longest. But again, I always look at what's happening with that person and what can I do to get them adequate calories and protein to maintain their strength.
Yeah.
Because I just want to follow up with that with one more thing. I'm sorry.
No.
What happens is if I can't keep your strength up and I can't help you keep your strength up, you get weak, and then this puts you at risk for not getting a treatment. And the medical management right now of this disease state is what gives us the best results long term, and making sure you get your treatments. So I'm here to support you to maintain strength so you can get your treatments on schedule as the doctor prescribes.
That's helpful.
Yeah.
There are a couple of just comments around the importance of vitamin A that will be prescribed if you are on a gene silencer, such as the Tegsedi or Onpattro or Amvuttra. That's something that you should definitely speak with your physician about to make sure that you're getting the right amount.
Yeah, you absolutely have to talk to the physician and make sure it's appropriate for you in how the dose and monitoring and making sure you don't have a excess amount of vitamin A as well, because that is one of the vitamins that can have toxicity. So yes, you definitely want to make sure you're speaking with your physician.
And we have a question about for nausea and early satiety, is there a role for cannabis?
Okay, so this is a hot topic. I will start this conversation by saying that I have not been formally trained in prescribing any sort of cannabis. But I will say that there is research in, most of the research that I've read is in specifically oncology population, but some of these symptoms can carry over to the treatments for amyloidosis. So there are some generalized recommendations that cannabis can help with nausea control and help improve your appetite. This would be the THC, not the CBD. They're two different products often in these cannabis. But again, I encourage you to talk to your care team. If this was something you were to be interested in, looking to see if you do have a provider in your facility that is trained in dosing of this. If this were something you are going to do on your own, if it is legal in your state, I recommend avoiding it from a licensed provider and starting off extremely low, and if not lower than the lowest dose available, because you just don't know what symptoms you might have or side effects you might have from partaking in that, and making sure you're in a safe environment. But talking to your care team first is so important to just make sure that they are on board and at least know you're doing it. Excellent. But yeah, there is research that's showing that it can really help with nausea control in certain populations.
So thank you for that. There have been so many questions. There have been quite a lot looking at asking about specific diets. And I think it's something at ARC we will commit to following up and picking Brianna's brain, but putting together some fact sheets to help with that. So for different symptoms that people are experiencing, they're pretty common across different types of amyloidosis. I did want to take one moment to just share a slide with you. So Brianna, if I can ask you to.
Yes, absolutely.
Sharing, and I will share my screen.
There you go.
Thank you. And I just hit the share button. I just wanted to bring to the attention of everybody a survey that we have going on and ask, this is only open to patients, but we would love your participation. It's a survey about the patients' preferences for imaging in diagnosis and monitoring of amyloidosis. You can find the survey at archi.org. It is only open till the 1st of November. And if you go onto the website, this on the right-hand side is our website, you will see in this second, oh, I had an animation, there we go. On this, just if you scroll down a little bit from the top, this is where the survey is, and it tells you a bit more about it. We are doing, we're hosting a meeting at the FDA as part of our Amyloidosis Forum. It's a scientific meeting in mid-November, and it's really to look at how we can use imaging in both the diagnosis and monitoring and clinical studies. So we really want to ensure that any conversations that happen are focused on what patients want and need and understand the value to patients. So we'd really appreciate it if you take a moment to join us. So it's at www.arci.org, and that will take you to the survey. Thank you. And lastly, Brianna, this was fantastic. We had so many questions, we couldn't even get to a third of them. We will reach out to you with some of them and make sure if you've asked a question, we will be getting back to you and answering them. So I apologize that we have run out of time and haven't been able to answer them on air. This was really an exceptional talk, and it's just so helpful and to hear and get guidance on diet, because it is such a complex disease and really there's such an impact on managing the GI symptoms. So thank you very much for your time today.
Thank you so much. Have a good day, everyone.
Have a good day. Bye.